Happy Friday, everyone. It's February already, and I hope you're staying warm. It's actually kind of a warm, weird, windy kind of day here in the DC area, but in any case, I hope you're safe and healthy and well. Today, we're going to talk about under-eye bags, and this is part one of the discussion today. So, we're gonna kind of go over the anatomy of the under-eye area as well as what we can do about it without surgery. So we have a couple announcements. As you heard from the last time we did the live, our estheticians have a Diamond Glow microdermabrasion device now, and a lot of people, including the staff and I, have really enjoyed the treatment. So it's a nice way to extract, exfoliate all the junk that you don't want in your skin, and it's a great way to infuse very good medical grade serums so that your face can feel healthy and feel glowy and radiant. So please book with our estheticians, Kat and Sun. They're here Tuesday and Wednesday respectively, and I trust both of their hands and both of their clinical acumen. So for that glowy skin during the middle of winter, Diamond Glow is a great option for you. So we look forward to seeing you for that treatment. You can buy packages of 3 or packages of 6. Please call our office for more information. And speaking of which, if you text the word bags to our office number right here, you have till the end of the month to receive 20% off select skincare products. Especially during the winter time, you want to take good care of your skin. It's kind of like going to the car wash in the winter time. You want to get all that snow off, all the junk from the salt that's been sprayed on the roads. So just like that, you want your face to have nice, good products and a nice, nice healthy glow for the winter so that you can prep into the springtime. What else do we have here? We have people getting married. So one of my patients is the maid of honor at an upcoming wedding for her best friend. So she is able to take advantage of an offer like this. So this offer is available to brides, mother of the bride, mother of the groom, and bridal party. So it's a special package of skincare products specific to looking really glowy and radiant for the wedding day, as well as a Diamond Glow treatment. It's a special price, limited time offer, so please call to take advantage. All right, so we're going to talk about under eye filler today. So the under eyes are a tricky area because there's a lot of things coming together here. So you have your lower eyelid, you have your upper cheek, and also you have the outside of your nose. So this is a critical junction where anatomically there's a lot going on. The reason that, you may have an issue, let's say with the dark circle, it may be with the bag, it may just those are the main 2 issues that people bring up when they come here for consultation, and they talk to me about what they can do. So the thing about having dark circles is that a lot of the times it's not that the actual skin is dark, but that there is a shadow made by the fat above it coming forward. Okay? And so it's not a matter of helping the actual color of the skin, although that's what you do when you apply makeup, right? But what instead you do is you want to bring this relatively retruded area right below the fat forward, okay? And so a great way to do that is with volume replacement, okay? And one of the ways that we can replace that volume is with filler, okay? So let's go to the next slide, please. Okay, this young lady, she is in her late 20s, and she was bothered by what looked like dark circles under the eye. Okay, and this dark area is located between the fat that's right below the eye and the fullness of the upper cheek. So what we did for her actually was we helped define her cheeks a little more along the outside, give that triangle of beauty a nice emphasis right there, and then we filled this area with a little bit of Restylane. Restylane, as you know, is a filler made of hyaluronic acid. It's not hydrophilic, not super hydrophilic, which means it doesn't attract water to itself. The type of filler that I generally like to use here, is not one that attracts a lot of water. Juvederm Ultra attracts a lot of water, so I really shy away from that filler, in particular for the under eye. So Restylane is not hydrophilic, so therefore it doesn't make water ebb back and forth, making it more prone to unexpected or uncontrolled swelling. So I think this patient got a nice result, and she's very happy. And in her case, it worked very well for two anatomic reasons. The first anatomic reason is that the fat coming out along the lower eyelid is not too far forward. Okay, if that's too far forward, it doesn't matter how much filler you put in below, that fat will still look like it's coming forward, and that will take the light and still make it look hollow, even if you put several syringes of filler in this tricky area. The other criterion that she fulfills is that her cheek, upper cheek, is relatively full. If you have a drop off here in the upper cheek in terms of volume, it's going to look unbalanced if you fill the tear trough area but don't give the upper cheek adequate volume. So for that reason, for those two anatomic reasons that she qualified, we got a nice result. Okay, next slide please. This young lady is in her mid-20s, and she had a little bit of a shadow here as well. So we talked about giving her cheeks a little bit of oomph, as well as, helping the shadow right here. So we did a little bit of Restylane contour along the cheeks, and this is immediately after the procedure. And you can see right there that the shadow is much less. So when the fat from the lower eyelid, which is right above that shadow, is not too big, and there's enough volume right here along the upper cheek, right below the tear trough, then you're more likely to have a good result. Okay, so like I mentioned a car wash before, as long as you are treating your under eye area, you want to take good care of it, starting with your skin. And that starts with your treatment at home. So we're very excited that we have really good eye creams available to you. They're not available on Amazon, and they're not available on other online retailers apart from going through us. So we've carried Elastin for a long time, ever since we started this office a few years ago, and we really love the eye cream. And the Elastin, they're known for, helping to restore the elastin fibers that give you this bounce back. Okay, what happens also over time is that things can lose their elasticity, and when you go like this, it doesn't bounce back like my youthful self. So Elastin's Trihex technology is very good for that. We also have introduced Skin Better's eye cream, so they have interfuse technology, which is also very great. Skin Better is a relatively new company like Elastin. It came onto the scene about 5-6 years ago, and we love a lot of their products, so check them out next time you're in the office. So just like you want, if you have a nice car, you want to take it for a car wash regularly. So if you have nice eyes, which you all do, you want to take care of it every day by applying good eye cream. All right, so that's a little bit about the under eye issue, what type of filler I use, who would best qualify for this treatment. So if there are any questions, you can write them in the live.
Okay, there's one question is, how long does under eye filler last?
Under eye filler lasts at least 1 year. And I'll say this in general, hyaluronic acid fillers last about a year in most parts of the face. The two parts of the face where I've seen it last much longer are in the nose and also in the teardrop. The reason why part of the reason why is likely because other parts of the face move with your facial expressions, but the tear trough area, there are no muscles that pull on the tear trough, and there are no muscles that make your nose, expand or contract. Also, it's kind of a blood pore area, so the metabolism in terms of breaking down filler is probably slower in those areas also. I recently operated on somebody for their lower eyelid bags, and they forgot to tell me that they had lower eyelid filler in this area about 2 years before the operation. And we're going, after I remove the fat bags, lo and behold, I see some filler there. So definitely it can last more than a year. That's good or bad depending on what you're going for. If you like your under eye filler treatment, it can go for way longer than a year, which is great. But if there happens to be an issue with it, there's always filler melting shots in the form of hyaluronidase or Hylenex that I can administer for you.
Okay, Dr. Kim, there's another question where, what other than surgery and filler, what treatments are there for my under eyes?
So when somebody has a combination of, let's say, rough skin or darker skin, along with kind of that aged appearance where you have that little shadow, you can inject PRP into the area. PRP is platelet-rich plasma, which can be extracted from your blood. And after your blood is drawn, we spin it down, and the yellow liquid on top is PRP, and it's a very concentrated mix of growth hormones, other growth factors that help rejuvenate your skin and your tissues. So it's been used for a long time in other arenas of medicine for regenerative purposes. And so by injecting it here into this area, it's a very good treatment. Number one, because it's your own body's material, and so it won't reject it. Also, there's no risk of a Tyndall effect. So a Tyndall effect happens when there's a bluish hue here if the filler has not been if the filler is injected too superficially. So with PRP, there's no risk of that because it's not a foreign hyaluronic acid gel. So that's a treatment that we do sometimes for people who are the right candidates, and they have nice results.
Wonderful. Another question is, I heard there's a new way to inject under eye filler through the mouth. Do you do that as well?
So through the upper gums, some people have been promoting that on social media. I'm generally not a fan. I can see why some people would like it, because it might be less intimidating than a needle near the eye. If you have a needle here, it may not be, you may not see it going in as much as a needle being right here. I mean, that might be one thing. Another thing might be that, some people champion it because you're less likely to bruise. However, my thoughts are these three. Number one, if you put a needle in your mouth, you're putting your mouth germs on the needle. And so if your mouth germs go into an area that's deeper in your tissues, you're exposing it to potential germs and infection. So if that were to be an issue, it could develop into something more serious. Number two, I think that generally if you're putting something in your mouth, you're distorting your resting anatomy. So if you're looking at this area with your lip up like this, you may not see the anatomy at its resting position. So the bulge of the syringe and needle along the upper cheek may not be the best option in terms of seeing the good, resting result. The third thing is, I've done surgery through this area to fix cheek fractures, and I know where the infraorbital nerve and artery are. They're right here. So if your needle is pointing in that direction, I think there's an increased risk to injecting into those structures because your needle is parallel to them. If your needle is out here on your skin, your needle will probably be perpendicular or will definitely not parallel to the infraorbital neurovascular bundle. So for those three reasons, I won't do it. There are, I'm sure, injectors in this area who are very good at that technique, but personally, I wouldn't do it, and I wouldn't recommend it to you.
Okay. And another patient asked, what if I want to have surgery rather than fillers?
So surgery is for next time, so please tune in. But in the meanwhile, if you have, I'll just give a prelude as to who would be a better candidate for surgery. If your eye bags are too far outward relative to your cheek and your tear trough area, then you would be a better candidate for surgery.
Okay, Dr. Kim, it seems that there's no more question. Any ending remarks?
Don't forget, please text the word bags to our office number. Anybody who texts the word bags can get 20% off select skincare products till the end of the month. We are very close to hiring our new office manager, so please be on the lookout for a new face in the office in the coming weeks. We're very grateful that this new person will take us to the next level in terms of the office, helping you, the patients, and helping our staff to grow together to bring you your our very best in our facial aesthetic services. So thank you for tuning in. Have a great weekend. We'll see you next month.